Awesome. The recording is on. So just a few quick things from a logistics perspective. If you are not speaking, I ask you that you kindly just mute yourself. And just for a little bit of context on today's meeting, I will be introducing to everyone our guest of honor. I will also be giving her the floor so she can be giving us a very personable presentation. I and her will be going through a couple interview questions that I have prepared. If time allows, we're definitely going to take some Q&A, and we actually have a really, really fun giveaway towards the end of this interview. And without further ado, let's just go through this introduction. And I had the pleasure to talk to Dr. Maky at the beginning of this week, and I was telling her that in researching her and trying to get to know her, having to write her introduction in 3 paragraphs was extremely difficult. She's so accomplished. So this was a very, very hard task to complete, but I tried my best. So let's go. So Dr. Maky Zanganeh is one of the most successful leaders in the healthcare industry. She's currently the Chief Operating Officer and board member at the Summit Therapeutics. She also has a not-for-profit organization called Maky and Sean Zanganeh Foundation, which she has founded with her son, with the mission to direct impact society by supporting research development in healthcare, aiding family health support, and by disrupting the barriers to education. The list definitely does not stop there. Dr. Zanganeh, as a Chief Operating Officer at Pharmacyclics, led a struggling biotech company to a multi-million-dollar collaboration and license deal for ibrutinib with Janssen Biotech in 2011, and the subsequent sale of the company for $21 billion in 2015 to AbbVie. This was the second largest biopharma sale ever in the industry. The deal with Janssen Biotech received the award of the best biotech transaction in 2011. Under her leadership in 2015, Pharmacyclics also was awarded the prestigious Prix Galien, the best pharmaceutical agent. For those who don't know, this award is the biomedical industry highest accolade and recognizes outstanding achievements in the development of new therapies. Dr. Zanganeh is an honored speaker of the United Nations. In February 11 of 2022, she has actually recently spoken during the closing ceremony during the United Nations of Global Movement. Zanganeh was also the president of EMEA, Global VP of Training and Education for Computer Motion, Inc., which later merged into Intuitive. Dr. Zanganeh was also awarded her DDS from Louis Pasteur University and Schiller University, and also an MBA from Schiller University, all in France. She's fluent in French, German, Farsi, and English, and she earned her first Biotech 2013 Top Woman in Biotech and the E&E Company Entrepreneur of the Year 2013 award. However, what's most important to her is the fact that she's a mom, a friend, an investor, actually one of the earlier Medable investors, a breast cancer survivor, and most recently, a writer, having launched her memoir, The Book of Magic, the Magic of Normal in 2022. Dr. Maky, we're incredibly lucky to have you here today, and we cannot wait to dive into your stories and experience. Thank you so much for being here. And with that, before I give you the floor, I do want to hand it back to Michelle. I know she wants to say a couple words. And before she does that, we are absolutely giving you the floor so you can go through your presentation.
Awesome.
Thank you very much.
Well, this is just such a special kind of moment for me. You know, what's really interesting historical kind of component of our journey at Medable is just how formative Maky was to our company. And, you know, I met Maky back in 2015. And at that point, I was still working at Stanford, but I had, you know, got Medable slightly off the ground. And, you know, it was really through Maky's support and investment in Medable that I was able to leave Stanford and pursue Medable full time. And, you know, really this absolutely life-changing opportunity for me to take entrepreneurship in our company to the next level. And, at the same time, when I was doing that fundraising, what's really interesting is there were a number of other investors, and, this is before the Me Too movement. And there were some very kind of unethical and I would say slightly, less than desirable dynamics that I was seeing from the investors that were potentially participating in the round. And then Maky comes in almost like a guardian angel. And, I have the opportunity to meet her and her partner, business partner, and Bob, and they, saw what we were doing and saw huge potential and made a $3 million investment. And, it changed the history of my life and really everyone here at Medable. And, I think that it's people that really shape our lives. We don't leave the earth with anything. It's all about the relationships. And Maky has served as a mentor, as an inspiration, as somebody who was formative in our journey, and someone that we would not be where we are today without her. So, and I really can't emphasize how true that is. And also one of the things I just value so much about her is, it's our relationship and where she's able to provide guidance for me extends far beyond being an entrepreneur. It's about how to live a life of satisfaction and a life of significance, and one where you're really able to, make the most of the rare and short time we have here on earth with the people we love. So with that, thank you, Maky, for the way you've enabled all of our lives here at Medable, the lives of the patients that we shape. And, in celebration of International Women's Month, I don't think there's a woman on earth who, to me, has greater significance in the positive outcomes we're trying to drive here at Medable and for me personally. So thank you for your time today, and everyone is in for an incredible treat. So I'll hand it over to you and to Camilla, but just really, thank you from all of us at Medable for making what we do even possible, from believing in us a while, 5 years, 6 years ago.
Michelle, thank you very, very, very much for this introduction. Camilla, the same. And honestly, you, Michelle, it's very difficult to talk after you. And everything that Michelle say to me is ditto back to you. But thank you very much, Michelle. But thank you, honestly, for having me today and talking in Medable in such an event, which is the celebrating together this incredible woman in the world. And for sure, I appreciate the company's mission, which highlights women who make a difference. And before I start to talk about my achievement and my challenge is, as Michelle said, both of us, we met in 2015 and we decided to invest in a Medable company. And for sure, all these years, no matter how the stormy was the weather, how challenging was the road, Michelle stood tall like a redwood tree. She has been unshakable. She worked hard, dedicated her life to her purpose, her goals, her team, and her company. So 6 years later, she built an amazing company with the help of each one of you. And congratulations to each one of you. You made it. I honestly, I don't know. I spent a lot of time with Michelle during this period of time. And every day I was more amazed than the day before. And today I can say I'm just proud to see her and to see each one of you to be so successful. But beside that, I'm really blessed to have Michelle in my life, because beside of my business and friendship relationship, I couldn't overcome my cancer and cancer treatment and COVID without her. And I couldn't never get the Stanford treatment and being in California without her help. So I really owe my life to Michelle before I start my life. Thank you very much for that, Michelle. But I just want to start is a little bit.
Dr. Maky, you actually muted yourself accidentally.
Sorry.
It's okay.
Sorry, I just said my presentation is going to be like 20 minutes. I'm trying to just
it's okay.
And then after that, as Camilla said, we can discuss together about any question that you might have. But allow me to take a few minutes to retrace my life spread over 3 continents and 4 countries, and give you the key of my own success in life. The key to changing your life and be successful is education, take chances, learn from mistakes, focus on future success, and never give up on your dreams. I would like to take this opportunity to thank my parents who raised me according to their principle, close to their heart, which are politeness, respect, health, and education. Education will open all doors and will allow you to achieve your dreams and break the boundaries of gender, language, culture, and border. I was born in 1970 in Tehran. I went to the French Iranian school, Jeanne d'Arc, which was closed in 1978 at the Islamic Revolution in Iran. So I went through a lot of things, through revolution, to Iran-Iraq war, and I believe everything that today you can see in the Ukraine-Russian war, which is the shortage of the basic food, empty stores, especially groceries, water shortage, gas shortage, power cut, and constant moving from one place to another to avoid the Iraqis' rocket and bombs during the night. Spending a lot of night in the mountain with minimum that we could take with us, and continuing the school during this crazy time and surrealistic environment of war. To be honest, I would never wish anyone to have the same experience that I went through to my life during this period of time. But this experience shaped my life and changed my way of thinking. I become survival in life, and I would never accept being a victim, no matter how many challenges I would have to face in the years ahead. The changes I lived through during that time changed who I was and became forever. And really today, my thought to all of the Ukraine and even these innocent Russian people that they didn't choose to be a part of this war. I had the privilege of being able to immigrate to north of Germany to continue my schooling, spend my adolescence in the country at peace, but at the price for being separated from my parents and my sisters. With my good background in mathematics and science, which is the universal language of science, I overcome at the beginning to continue my schooling in Germany with a new language and learning the new culture. I learned a lot, I worked a lot, and I fought a lot for my own identity in Germany. And Germany really helped me to build my character. It made me tough. But my life didn't end there. I still continue. So after obtaining my Germany high school and my high school diploma, I joined my sister in Strasbourg, France. Both of them medical, at this moment of time, they're medical student. They finished medical school. So I decided to go to dental school, and I received my dental degree of surgery in France. But during the time that we were in Iran, my mom always told us, to the 3 of us, choose a profession as a woman that could help people, that would allow us to be both financially and socially independent, no matter where we ended up living. So I continue my study. I finished my pediatric dentistry, and I started to work as a pediatric associate professor in the university. I was exposed to so many different situations that I never imagined I was able or capable of facing in my life at such a young age. We were treating cancer, autistic, mentally and physically handicapped kids. It was very difficult children who have no idea why they are so different than everyone else in the world. And at this moment of time, honestly, I just couldn't see all of this pain in these kids. And I was a little bit I just say life is perhaps bigger than that. And I try to just move on to a different part of my own interest, which is having a bigger impact in life. So I decided to leave dentistry and during this period of time, and joining the business world. So during this period, I became more aware that society needed massive action to turn things around. And as for me, I needed a bigger project in my life that would have a bigger impact on the world. The only predictable thing in life, it is unpredictability. So I left dentistry for healthcare business, and I decided to get my MBA from Schiller University. My generation has seen the digital transformation of society. I'm among the last generation to have known the typewriter with the ink, the arrival of computers, the electronic agenda, mobile phones, and internet. And in the late 1990s, they revolutionized surgical procedures via robotics. So in 1998, I became the president of Europe, Middle East, and Africa for Computer Motion Company, the leader of minimal invasive surgical robotics. I was traveling around the world from Europe to Dubai, to Jordan, Saudi Arabia, Egypt, Taiwan. It was an unforgettable journey. And each country was different than the other, but beautiful, each one of them in its own way. But my major achievement at Computer Motion came in September 2001. We performed the transatlantic telesurgery, Operation Lindbergh, the first telesurgery operation between New York and France. Professor Morosco used a robotic system from New York to operate on the patient in Strasbourg, France. It was a perfect blend of digital information, technology, and minimal invasive surgery. We showed the world that surgery can be performed from a distance of over 10,000 miles via robotics. That is possible to collapse the barrier of space, distance, and time. And actually, it was an interesting story at the moment that we did the Operation Lindbergh, because we did that on the 7th of September 2001. And we're supposed to be in all of the media, in all of the world, and everybody would talk about us. But Professor Morosco decided to not, to wait till we know that the patient is 100% okay. So we decided to go to the media worldwide on September 13, which is my birthday. And what happened, I never forget, on Tuesday morning, Professor Morosco came and just said, Maky, if nothing happened, if there's no crash of any aircraft, we will be on the first page of all of the news. I said, okay, I mean, why you are even thinking like that, you know? Then I remember in the afternoon at 1 o'clock, which is New York time, I don't know what time was, in the afternoon, we were in Europe. Professor Morosco called me, just said, Maky, come down, come down. I just said, what? Just said, it's not one aircraft, not second. It was September 11, 2001. And that was the moment. And I just said, oh my God, that cannot be true, you know? And not just, it was a very sad day, but our news couldn't come out at this moment of time and take long till we show it to the world, what's happened, what's going on the September 7 on our side. But it was very interesting moment to just say, we did it in a way that years gone, I still think that was one of the biggest things that I ever did in my life, because it was so surrealistic to see these operations from 10,000 mile distance between New York and France. But anyway, my French victory in 2002, I just left France and I came to California. I decided to leave surgical business for medical oncology and dedicate my life to the cancer patient and trying to find a drug which can help patients to survive longer with minimum side effects. So I joined Pharmacyclic in 2008 and I started to work as a chief operating officer. Actually, Pharmacyclic was an unbelievable company. It was at the moment that I started to look at different companies for investment in 2003, after I left Computer Motion. And I look at 100 company and I fall in love in this one because it was something about brain met lung cancer. And my partner, Bob, who lost his son on the brain met, on the glioblastoma, I went to him and I asked, hey, Bob, do you want to invest in this company? At the minimum, we just say, no, yes, let's see what we should do. So we take a little bit time. So finally, we invest in 2003. And then in 2008, the entire market crashed. The company all all clashed. The value become on the 15 million market cap, and we just was 34 people into this company. So we decided to just jump in and start a business together and build the company in the way that, as I said, see what's happened, what's going on. And for sure, in our pipeline, it was a product named ibrutinib, and it was a covalent drug for cancer, blood cancer. I mean, even not blood cancer, we discovered it for blood cancer. And no companies, no big pharma, from Novartis, Genentech, J&J, everybody I called, they didn't want to put money, and we just have 6 million in cash. So Bob said, okay, I will give another 6 million. So we never go below 10 million cash in the company. And we decided to put the drug in the hand, to start the clinical trials. And 3 months later, the patient responded. And that was the beginning of the pharmaceutics and the beginning of our company. So then 5 years later, we brought this product into the market. And since then, it was a really patient-friendly oral therapy drug for blood cancer patients, and become a blockbuster drug in hematological cancer. And since then, thousands of people could get back to their normal, and that is the magic of normal, could get back to the normal life. And really, I can say we help the patients a lot to not be dependent to the chemo and radiations, and a single agent oral therapy, they could survive longer than expected as a blood cancer patients. But my life beside that, in parallel to this exciting and agitated professional life and the up and down, traveling from one place to another, time differences, conference call, and at any time of day and night, and is inevitable when you're in an international career, I leave 2 highlights of my life as a woman. The first highlight of my life was my pregnancy in 2005, working and traveling till the last day that I was authorized to travel. And I returned back to work 3 days after giving birth. I never understood until I had my son, Sean, what the meaning of motherhood was. The truth is, I love being a mom. I believe it is one of the most challenging and rewarding jobs ever. It is an unconditional love that you can give to someone. Many women today are afraid to start to work or take an executive position because they cannot handle the stress of both work and family. Many women in the business world even avoid having a child. And I do not honestly blame them, because it is not easy. Between long meetings during the day, too many sleepless nights, constantly reading emails, bringing kids to school, finding nannies, doing homework, managing sick days, and handling household activities, God help America. It is practically impossible to get through the week. And the weekends are not easy. All of the football game and basketball game and trying to manage everything at the same time. But my philosophy is God will never give you more that you cannot endure. And I really believe after so many years being in a high executive positions and juggling my work, my child, and everything around me, I can really say that is worth to have a kid. If I had a choice to do it again, for sure, I will do it. And because the children, they are honestly incredible. Children give you a whole different perspective in life. You are no longer the center of the universe. Your child becomes the center of the universe. And you get to see the world again through their eyes. You have to just tell to yourself, keep going, and do not even ask questions regarding what you as an individual you can do in this life. Your kids is your priority. Anyway, but my second highlight of my life was my breast cancer in December 2019. After all those years, being part of an oncology biotech company and trying to help so many patients, I believe God realized the game was not over for me. I learned what it felt like to be a patient by becoming one, the pain and suffering, and hoping for a miracle. Everything in life happened for a reason. That was always my life philosophy. And I really believe God will never give you more than you can endure. Having faith has always been a key aspect of my life. For sure, every part of my breast cancer was scary, and very challenging, from the announcement to going through all of the chemo, surgery, and radiation. And finally, in the middle of, as if my cancer was not enough, we had the coronavirus pandemic in 2020. The world had collapsed, so my world collapsed too. The hospitals were overwhelmed around the world, and the priority was to save COVID patients from dying from COVID. But finally, in summer 2020, I finished all of my treatment, and I had to reconstitute myself, get used to my new look of non-existent hair, not existent eyelashes and eyebrows, and settle for my short hair, and try to get back with a new perspective to my life as a businesswoman. It was an experience that has opened my eyes for my own life and the way that I would work in this world of the biotech and drug development, and which I will explain a little bit more about it. And really put me the value of life. I just become completely different, and my perspective of life has really changed once after my cancer. The difficult time in life should not make you doubt yourself or lose your self-confidence. In life, I have learned to live in the present and to enter fully into the moment, which I was not like that before my breast cancer. It was all about future, what I'm going to do, what's happening. And that was the difficulty of moments that you ask yourself a lot of questions. Why this, why that? And when you get a cancer, I believe they give you a perspective of the moment, that the moment has more value than any other time of life. So, and I recently as well, I realized that is 4 things in life that you cannot buy. You cannot buy health, you cannot buy love, you cannot buy time, and you cannot buy happiness. Every other things you can buy it, but not these 4 things in life. So it's very precious, in my opinion, where we are living in this planet. But over my career, I learned a lot about cancer patients and their spirit. I learned that to fight the cancer, we have to aim high and go for a cure as long as the body can handle it. In other words, fighting till the end and never giving up. I learned that 2% chance is not 0% chance, and 2% is 2%. And that is our purpose when we are working in this oncology field, because 2% is, you still have a hope that some company will come with an innovative drug, that they give you 1 more month, 2 more weeks time to really enjoy being with your family, doing what you want to do. But the truth is, when I got my own cancer and I took care of my father, who recently died actually, I realized that progress and innovation must take care of most basic needs. We may have invented, innovated, created anti-cancer drug, but it is everything else that gives the prognosis, and we should consider that. If you look at today's world, is more than, today 2/3 of the world population has no access to diagnostic imaging. Over 5 billion people do not have access to safe and affordable surgical care and anesthesia. And most cancer patients will not die from cancer. Majority of them, they die because of the side effect of cancer, like an infection. And believe me, once they hit the infection, one thing after the other, is not too many antibiotics exist that they can help them. So I started after that, when I saw all of that, I started to work at Summit Therapeutic just after I believe I finished my cancer treatment, because for me it was important to go back to this world of biotech and to try to, again, find another drug that perhaps could help a lot of patients, give them a quality of life, and really save their life. And finally, my message to all of you that you listen to my presentation today is follow your dreams, move forward, Life is in front of you and not behind you. Changing the world for the better, it is a true adventurous journey, not for the faint of heart, not for the impatient one. It takes courage to do things that others consider impossible. Perception, observation, knowledge, a sense of certainty, and a willingness to take chances is part of the parcel of innovation. Curiosity and caring about life and its forward progress, hard work and willingness to sacrifice are required to achieve your goals and purpose. We have to work together, collaborate to make a difference for the betterment of humankind. Together we can move mountain, and I hope you will always continue as if there are no limit to innovation, joy, and happiness.
Wow, what an incredible presentation. Thank you so much for sharing your story with us, Dr. Zanganeh. That is truly inspiring. And I'm sure that I'm not speaking just for myself, but so many of the areas that you touched on hit home really hard, especially for me, particularly when you spoke about having to find yourself and having to build yourself when you moved to Germany and having to really build the personality and find exactly who you are. Me being a foreigner and moving to America, I think at a very young age, it was also hard. And it was something that I had to build those blocks. So again, thank you so much for sharing your story. It's absolutely beautiful. Hopefully we'll have a little bit of time of Q&A at the end so we can open up and see if there's people with more questions. Perfect. But are we ready for some questions for me? So I think you touched in a lot of the stuff as I'm going to start asking in here, but I really wanted to start peeling the layers a little bit and give you the opportunity to just, again, just really peel the layers and talk a lot about how you got to shape yourself a lot more than what you've already presented to us. So again, you have such an incredible background. You are an extremely well accomplished person, not only professionally, but personally. And I've read one of your interviews, and I've read that it was really hard for you prior to your cancer treatment to be able to prioritize time and how it came for you, dividing time and things of that nature. So you clearly have a lot of projects. You have your foundation, you have the company that you're pretty much running right now and things like that. So I can imagine how hard it must be to take on all. So can you talk a little bit more on how you get everything accomplished between being a mom, writing a book, and getting all of your projects accomplished?
Kamala, that is a $1 million question, man. Nobody has a right answer. Believe me, it's no secret sauce, because I'm honestly, I don't know how I'm doing. From morning 5 o'clock in the morning, I'm running till late night. And between getting my coffee, doing the last homework at 6 o'clock in the morning, dropping off my son to the school, trying to send an emails to my assistant to remind me everything that I have to do during the day, and it's not easy. But one thing I know is always, as I said, every day has his own challenge. And every day when you wake up, you have to just breathe. You just say, what is today my priority? For sure, there's a lot of unpredictable things happen. Like, for example, but the kid is suddenly sick. They call you, what is going on? But at the end of the day, I believe what makes you successful is not just you, it's a lot of people that they are surrounding you. I mean, I have one of the lovely assistants ever, Marianne, which without her, I cannot do anything, because she every 5 seconds is like my Siri. Marianne, do this, Marianne, do that. But at the same time, so I come to the office and I see all of the incredible high achiever, really top-notch individual that they are working right now with me. And for sure, it's not easy either to work with me. I'm super perfectionist. I know I'm not control freak, but I'm super perfectionist. I have a standard, and the bar is very high. But nevertheless, I believe the people that they are around me, they are the same. So they make my life as well easier, And at the same time, you have to have really, when you get kids, you have to have a village around you. They are a lot of people that they help. So to answer your question is hard, but it's every day when I wake up and I just say, okay, what is my priority of today, and how I can achieve at minimum the goal that I'm setting for today. because I cannot do everything. And if you want to do everything, at the end of the day, none of them you can do it the best way that you want to do it. So that is the only answer that I can give, just be in the present time and keep going.
That is a really great answer. And I'm not going to lie, I really just wanted to deviate right now and ask you so many other questions based on your answer, but I can't. I have to stick to the script. But you held so many impressive titles in the healthcare industry and with your foundation, from being president, CEO, COO. Talk to me a little bit about the milestones that you had to go through to get there. And in the spirit of International Women's Day, what were some of the unique challenges that you faced, if any, for being a woman?
To be honest, I never see myself as challenge of being a woman. I will be very frank. I know that it's always a battle between men and women, but I never see that. I just believe if you have a good education, knowledge, and confidence, you can overcome all barriers. And with all respect of all of the men, if they are in these presentations, is at the end of the day, I believe I just realized why your engagement ring should be diamond. Sometimes I think about it, and I just realized all of the women, they are really like a diamond. It's a multifaceted. They can, when you go home, you put the clothes in the wash machine, you cook, you do the homework. In the meantime, you send your emails, and then you have to watch the football game and say, oh, everything is good with your husband or boyfriend. So your mind is all over places at the same time, but you can handle everything very precisely and nicely. And is a lot of women right now working with me. In my previous company at Pharmacyclics, it was 65% was top executive was woman. Is the same here at Summit, because I really appreciate the multitask way of thinking. Not that the men, they are not doing that. It's just a different way of the way that they are thinking. But I personally never put myself in the level I'm less or more than somebody else. Doesn't matter if it's another woman or is a man. I just believe it's all about the confidence and the knowledge and what you know and how you can present. And at this moment of time, believe me, even the most successful man will just say, you know what, she's one of us.
I'm sure. I have no doubts about that.
That is why all of the positions, COO, CEO, board members, and but at the end of the day, it's not about the title. I believe it's all about what you can achieve and how you can bring your team, especially in the business world, from A to Z, and you can help them to cross this the ocean of challenge and as well. I believe the success stories.
May I just add one thing real fast, because I think it's such an incredible outcome. Maky, could you talk about how you drove your team in these multiple kind of drug approvals, like with the Pharmacyclics story? Because, in talking to you and Bob, you were instrumental in really leading the orchestra that led to, I think, a scientific outcome we may have never seen before that. So we'd love to hear just for the team.
For the story of Pharmacyclics. You know what, it was, as Michelle said, it was an interesting story, because when we start with Imbrovica and that nobody really believed in the product, and we wanted, as any drug that you bring into the industry, you are careful because it's a patient. At the end of the day, you are dealing with patients. So we were with a really very with conscious to bring this drug, to put it in the hand of the patients. And the patient responded very, very nicely. And then after a few months working in this field, I just realized, okay, we have to really, everybody came to us, just say, oh my God, you will be the next Gleevec, you will be the next rituximab. And we started to really work hard to build this company in this level. But at the same time, these clinical trials, if I can, because you are into this world of the clinical trials, is we started with one, but then in around 2009 and 10, I just realized that this product will be bigger than what we believe is going to be. So we decided to collaborate with Johnson & Johnson. But before I go with a partner, I sit down with our team and I just say what we can do, where this product can go, how fast we can get there. And we forecast all of the clinical program at this level that imagine I get to the company in 2008. By 2010, we plan all of the 13, 14 phase 3 clinical trials. We plan all of the phase 1 and phase 2 clinical trials. And when we went to the J&J, we just said, that is what we want to do. We did a forecast of the 7-8 years. And honestly, the forecast that I did in 2010, I still have it, because that is exactly what's happened and what's today AbbVie is going through. I went to the team and I just say, we want to have one submission on the yearly basis. One submission means a submission follow the FDA approval. At this point that we end up in 2015, when I left, we had 153 IST program, 56 phase 2, phase 1, and we work on the 13 phase 3, which we got right now 10 approval in the multiple different therapeutic area. So it was, and all of that in the 4 years. I'm not talking 10 years in the industry. It just is a 4 years achievement on all of the team member. And the clinical trials, as you know, is just from A to Z. It's not easy, but for sure, the team did an outstanding job on that. And then
yeah, I just think that's so spectacular. Just commenting on that just in the moment, because you know, as a startup, sometimes we feel our goals are just unattainable. And I think people look at me like, wow, you're crazy, you know, but I think, you know, it's so important to set really big goals, because I mean, and this is something I've learned from you as a leader in that, you know, what you guys accomplished. No one, I don't think, maybe aside from you and Bob, thought that was even possible. Anyhow, kind of coming back to the importance, you know, of how you lead. I think that those big goals and then what that leads to in the future state and how that becomes reality is just something to really internalize, because that's such a big part of how we really get there. But
is what you say, Michelle, is totally build a company. You have to aim high. You have to aim high and go, because any other way, if you settle for the just the small dreams or goals, you can never achieve what you want to achieve in life. And again, it's important to have a team that they really start to have the same purpose and the same mission in the company. Otherwise, it's going to be very, very difficult to try to the people to work so hard. And but honestly, for me, was nothing beautiful to just see what's happened, what's going on by giving this product to the patients, and especially after my own cancer. Especially, it is so interesting because all of the time that I was at Pharmacyclics, I was thinking about one thing. I want to bring this drug into the market. Why the patients, they don't want to use it as a single agent frontline therapy? Why that is the most innovative drug, blah, 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 blah. The day that I got a cancer, I never forget, I went to Dr. Sledge and he just say, Maky, you have two options. The first options, you can have a chemo, radiations, and you are just going to, but is around 90-95% survival rate, or I can give you an innovative drug. You will be in the phase 3 clinical program. Is a targeted therapy, less side effect, but the efficacy is around 85%. It was the first time in my life that I couldn't make a decision. That I was all of this time, I was talking about targeted therapy, innovative drug, why the patients, they are not jumping in the water. Myself, at this moment of time, choose for a chemo because of efficacy. Because for me, 95% was not 85%. And I just needed to go. And I believe me, I went to the hell, all of my chemo and radiations, but my perspective of drug development has changed. And now when I'm in this company is different. I'm just going, let's start with the standard of care, bring it to the level that the patients, I'm 100% sure that I can help patients better than standard of care, with a higher efficacy and less side effect. But it's everything in life gives you, perhaps you learn a lot for everything that you are going through.
Yeah. I would like to add that there's a very common trait between you and Michelle, which is really nice to hear, and both of you being leaders, which is the acknowledgement that you both always make on your teams. And that's very, very nice to see it. Obviously, being in the receiving end of it most of the time, it's very nice to see from leaders like you, both of you.
Thank you, Kamala. But the truth is, you can never achieve success by yourself. You know, it's always is somebody and some people around you that they help you to be so calm, relaxed, to make the decisions and moving the entire ship forward.
Yeah. Well, I'm checking time, but we have a couple minutes left, and I do not want to leave this unattended. So we're going to move topics now. We're going to talk about your book. That was such a great achievement. And so let's just get into it. In talking about your book, The Magic of Normal, you had breast cancer, like you've talked about it. Obviously, you had that, you found out you had it before the pandemic, which my understanding is that it really forced you to stop and slow down due to all of your cancer treatments. But it also happened at the same time that the pandemic came through. And with COVID, that I can't imagine how scary all of that must have been for you. So can you talk to me a little bit about that, finding out you had cancer, going through the pandemic, making the decision of writing a book?
To be honest, I was going in my life, and I could never ever imagine that I would get cancer, and especially a year or all of the year before. I did all of the time. I'm somebody that I do kind of from head to toe. I do MRI, I do blood tests, and everything was perfect. And in the middle of nowhere, my cancer show up. And for sure, I have to slow down because I was very, very sick during my cancer, and I got all of the side effects that somebody could ever imagine that get. At this point, that my doctor, Dr. Sledge, told me, in all of my professional career, I never see a sick person like you, and I'm happy that you make it, and please do not come back. So to tell you, during this period of time, it was before that I was talking with someone that just said, Maky, you have to write your book, but I never had a time to write a book. And I never thought that writing a book is not important, but just say it was not in my path. And then after that, when I got sick, I just said, okay, why not? So I started one night to write my story. And then Cheryl, who was talking all of the time about that, look at it, just said, Maky, you have to continue, you have to write your book and everything. So after that, it was interesting, all of your feeling and emotion during this period of time. I believe if you ask me today to write the same book, will never gonna happen, because it's not the same feeling, it's not the same emotion, it's not the same perspective of life. Was in the middle of COVID, everything was stopped. I was stopped. All the world was just has a different approach. And then after that, I just look back a little bit and I just say, why not to write about pharmaceutics? So my book is partially about me, my life, my perspective of life, and partially is about pharmaceutics and our achievement, just because it's for all of the entrepreneur and all of people that they want to be in the industry. It would be nice to read this kind of the story, how you bring something from nothing to something, and then how you can really help in a biotech and having such a big impact. You know, you just have to be persistent and having patience to make some things go right, you know. So that is why I decided. And after 1 year, oh my God, everything is done. And then in the middle, for sure, I started to work, and everything worked out fantastically, to be honest.
And what was the feeling like publishing the book, having it ready and publishing and having that accomplished?
To be honest, it was not something that I can say I would expect this feeling, but to be honest, it was amazing. And especially that you see yourself now in the Amazon, you see yourself in the different pictures. Oh my God, you see your book everywhere on the table. Oh my God, it's me.
So I think it's a good time for me to pause right here now and actually let everybody know that's on this call that we have a ton of her book, the Magic of Normal, and we're actually going to be selecting a lot of you that have joined the call, and we're going to be gifting a lot of you a copy of her book.
I really appreciate it. Thank you very much. And if
I think it's important that we, and as a company, and Maky and I have talked about this, the book is so important and pertinent to what we do. So, beyond what Maky has been able to gift, of course, we will be able to provide a copy for everyone, because, this is why we do what we do, both in, enabling patients and helping people, but also, all of us collectively as risk takers and entrepreneurs and lifelong learners. So I just can't emphasize enough like the incredible amount of learning that, the book provided for me and for our team. There's not a person in our company who won't benefit from the story. I think parts covered today, but the book there's so many things to take away that are relevant to what we're doing and the people we want to be. So, everyone will have a copy of the book.
Thank you very much, Michelle. Thanks a lot.
I'm going to close my questions with a really fun question to you. And we might have a little 5 minutes to go, which I'll probably just see if there's any questions on the chat or just open up to see if anybody has any feedback to you prior to for us ending this interview with you. But if you had, I tend to ask this question to most people when I meet them. And if you had to choose one meal to eat for the rest of your life, what would that be? And that can be, you have total free range in here. You can include appetizer, dessert, entree, drink, or you can just pick one of them, whatever you want.
Dessert. I love ice cream.
Me too.
The rest of my life, I can eat ice cream any form and shape. And I love dessert because they are cute, they are nice, they are sweet. You can mix, match it. The rest, forget about
ice cream.
Okay. And then you have to go to the gym anyway. So
ice cream. Any special flavor of ice cream?
Oh, I love Agendas and I like dulce leche. I know exactly what I want.
Perfect. Yeah, that is a pretty good one. I'm a pretty big fan of that one as well. So
yeah, thank you.
That is awesome. Dr. Maky, I had such a pleasure getting to know you through my research, through our preps, through interviewing today, to getting to know your presentation. I just want to personally thank you so much for your time. We still have 5 minutes. Michelle, I don't know if you have any closing words, but I think we still probably have time for maybe a piece of feedback or question from anybody on the call. I just see a bunch of comments coming through the dessert.
I would love to just, I think one thing that stands out to me is just your incredible resilience. Like every day I think, about how important resilience is. And your life and your childhood and the things you endured. Like if you were to say, where does that resilience come from? Where do you think that kind of source of unstoppable determination is coming from?
That's a good question, Michelle. I believe, when you went through to how I started my life, and especially I personally believe when I was in Iran and we saw everything that we saw, and now perhaps more people by just opening television, they see how much suffer and pain you are going through. You get stronger and you want to fight, you want to achieve, you want to go. And at this moment of time, you're not just saying, why the others, why not me? Why I cannot achieve what the others is achieving. And then after that is for sure is a purpose. Every time you put is another purpose come into your life and you just say, what, I want to get this, and you are working hard to achieve it, and then suddenly you grow up over time, from your teenagers to the normal life, then you have your kids, then you have your community and your work. But to be honest, it's very hard to answer your question, but I believe it's just what motivates me in my life, you know, is every day that I'm waking up, I just, okay, you know what, I want to do this, you know what, I have to do that. And I just say to myself, you know what, why not me? You know, if all of these people can do, okay, I cannot be Kobe Bryant, I dream to be like him, but you know, it sometimes is, it's just, that is really motivates you to continue, you know. And I love the fact, and without determinations, without the courage, without, you know, all of that, it's very hard to go through the day, you know.
Absolutely. That's so beautiful.
But
Oh,
any
thank
other
you.
questions?
Yeah, any other questions? I have a ton of feedback coming through the chat. Everybody's extremely inspired and everybody's excited to read your book, and everybody's thanking you for the incredible presentation. In being respectful to your time, I think we're right on the dot. So again, I just wanted to thank you again for the presentation, for being with us. And I'm sure that everybody gotten a lot out of this. So thank you again.
Thank you very much, Camilla. And again, thank you, Michelle, for who you are, what you are doing for your team, what you are doing for not just the society. I mean, your achievement was beyond imaginations, how you did it, and really impressive. It's really impressive. And as I said, thank you very much for having me in for today.
Well, thank you. You show us it's never easy, but it's way more possible when you really absolutely wake up every day and make it happen. Yeah, thank you for everything you bring to our lives here at Medable. We wouldn't be this company without you. So a really special moment.
Thank you, Michelle, and thank you to everyone, and thank you for your time.
Thank you.
Thank
Bye-bye.
you.